This video contains information about the use of Ovidrel pre-filled syringe. This drug has been prescribed to you by your doctor for treating infertility. To help you prepare and use this medicine, watch this video and read the instructions provided carefully. Ask your doctor, nurse, or pharmacist to explain anything you do not understand. Keep the leaflet. You may want to read it again. Preparing and self-administering Ovidrel pre-filled syringe. Getting ready. Make sure you have all the necessary materials assembled in a clean area. 1 Ovidrel pre-filled syringe, alcohol swabs, gauze, and a sharps container. Wash your hands with soap and water and make sure you are working on a clean, flat surface. Step 1. Preparing your injection. With the needle pointing upward, carefully remove the needle cap from the syringe. Remove any bubbles by pointing the needle up and tapping on the syringe. Push the plunger carefully until a small drop of liquid begins to appear from the tip of the needle. Step 2. Inject. Choose an injection site in the lower abdominal area, preferably around the belly button, but at least 1 inch away. Carefully clean the injection area with an alcohol swab and allow it to air dry. Hold the syringe in one hand the way you would hold a pencil. Use your other hand to pinch the skin on the chosen injection site. Insert the entire length of the needle at an angle of about 45 to 90 degrees as indicated by your doctor or nurse. Release the skin. Push the plunger in a slow, steady motion until all of the medicine is injected. Take as much time as you need to inject all the contents. Gently withdraw the needle. Apply pressure to the injection site with a gauze pad. Step 3. Disposal. Discard the empty syringe in your sharps container. Do not throw away empty syringes or loose needles in your household trash. If you do not have an FDA-cleared sharps disposal container, you may use a household container that is made of heavy-duty plastic, fitted with a tight puncture-resistant lid, leak-resistant, upright and stable during use, and properly labeled to warn of hazardous waste inside the container. When your sharps disposal container is almost full, follow community guidelines for disposal. For more information, go to www.fda.gov/safesharpsdisposal. Step 4. Storage. The Ovidrel pre-filled syringe must be refrigerated between 36 and 46 degrees Fahrenheit before being dispensed to the patient. Patients should refrigerate the pre-filled syringe so the product may be used until the expiration date shown on the syringe or carton. The Ovidrel pre-filled syringe may also be stored by the patient for no more than 30 days at room temperature, up to 77 degrees Fahrenheit, but must be used within those 30 days. For more information and the full prescribing information, please visit www.fertilitylifelines.com or call 1-800-LET'S-TRY. Important information about the proper use and risks of Ovidrel pre-filled syringe, choriogonadotropin alpha injection. What are the uses of Ovidrel pre-filled syringe? Ovidrel contains recombinant human choriogonadotropin alpha, HCG, an injectable hormone that causes your eggs to finish maturing and be released. You may be given Ovidrel to complete this final stage of your cycle. Your doctor may prescribe Ovidrel pre-filled syringe because you require hormone replacement or supplementation as part of several drugs prescribed to a patient as part of a treatment program. Who should not use Ovidrel pre-filled syringe? You should not use Ovidrel if you are pregnant or breastfeeding, if you have primary ovarian failure, the ovaries no longer produce eggs, or have allergies to HCG or any other ingredients in the medication. Do not use Ovidrel if you have cancer of the sex organs or brain, or uncontrolled thyroid or adrenal disease. Tell your doctor if you have a history of abnormal bleeding from the uterus or vagina, swollen, enlarged, or painful ovaries before starting treatment. In infertile women undergoing assisted reproductive technologies, ART, and ovulation induction, OI, Ovidrel should not be administered until adequate follicular development is indicated by serum estradiol and vaginal ultrasonography. Ovidrel administration should not be used in situations where there is an excessive ovarian response, as evidenced by multiple follicular development, clinically significant ovarian enlargement, or excessive estradiol production. What are the possible side effects of Ovidrel pre-filled syringe? Ovidrel can cause serious side effects, including ovarian hyperstimulation syndrome, OHSS, and lung and blood vessel problems. Tell your doctor if you experience severe pain or bloating in the stomach or pelvic area, severe upset stomach, vomiting, or weight gain. Use of fertility drugs can be associated with fertilization of more than one egg. This can lead to complications for the mother and the birth of 2 or more babies. The most common side effects in women using Ovidrel include abdominal pain, nausea, and vomiting. Needle injections may cause some discomfort.